This is the Rebound Tampa Bay podcast. I'm James Tully. On the line with me right now is ABC Action News reporter Michael Paluska, who did what I think was a phenomenal feature recently, getting a tour of the COVID wing of Advent Health in Tampa. Mike, thanks for being on with me today.
Hey, thanks, James. Appreciate you taking the time.
The feature, as I mentioned, was very captivating, and you're the only reporter in the Bay Area at Advent Health Tampa to get a firsthand look at that wing, the COVID wing. I just want to break it down and let you go long form and talk about the things you saw, and we can go from there.
Yeah, it's super interesting. You know, you think about the COVID virus and you think about like how they're treating people, and you see so much national news. I think you see all these hospitals where it seems like they're overrun and there's not enough beds and ICUs are full. So when we reached out to Advent Health, we really wanted to make the focus about treatments, like how people are getting treated, what have they learned, and how are they getting people out of the hospital sooner, off of ventilators, not even on ventilators. So when I approached them, I said, hey, let's just focus in on the medicines and the treatments. And that fourth floor COVID unit we went to was 24 beds, but they have several floors that are COVID floors. So that wasn't the only wing. Now, whether or not those are at capacity, you know, it changes daily, but they have several floors and they keep all the COVID patients separate. And then they still have to take care of all their other sick patients. So, I mean, they're really trying to separate the virus from other people that have to go to the hospital for routine surgeries, or if they get pneumonia or they get an infection or the flu or whatever. So it was crazy just to know that they're that close to the virus in these little bubbles within bubbles in the hospital.
I want to talk about that. And the feature itself is about 5 minutes long. I'm going to put a link right here in the description of this podcast. So you can literally listen to us and then go just click on the link and watch this on whatever device you're listening to this on. So negative pressure rooms is where I wanted to start. And this is something I had never heard of, although I'm not in the medical field. I'm not sure how many rooms normally would have something like this. Mike, you can go ahead and explain what negative pressure is, but essentially it's set up in a way, these rooms are, where no air is getting pushed out. It's all staying in, so the infected patient isn't passing that into the hallways or anything like that. Am I pretty accurate there?
Yeah, that's pretty much spot on. And a lot of hospitals don't have, like what Advent Health Tampa has, that whole floor is negative pressure rooms. Some hospitals might only have one negative pressure room per floor on each wing. So for them to have 24 is pretty incredible. And what happens is all of the air when the door opens is sucked towards the patient. So it's pushed towards the patient. It pushes the virus towards the back of the room so that, you know, when you walk in, you hear all that air blowing. And then all the people with the PPE, that when they go in, they have to make sure that they take that off in the room at the door where they know the pressure is still pushing it. Make sure that they don't come out with any of their gowns, anything like that. So it's super risky for them, because you can imagine they're walking into a room where some of these patients might be on ventilators. So they're aerosolizing the virus. So the virus is in that room. It is everywhere. You can't see it. But I mean, if they go in and their seal's not good on their mask, the virus can get in. If there's droplet spray and they don't have their face shield on and get in. But the negative pressure keeps it from going into the hallway. But if they don't do the right things with their PPE, they can carry it back out into the hallway and then infect that part of the hospital, like anything else, if the virus tags along on your clothes or something.
Exactly. So they come in they're very, very useful in this situation. I'm trying to paint the picture for people of what exactly you saw here. You know, you did get a chance to talk to a couple of the doctors, one of them, Dr. Ahmed. You know, actually,
Yeah.
we look at doctors and anybody who's had to have a surgery done, a major surgery, or has gotten treatment in the past. Doctors are always very clinical, right? They don't get emotional or anything like that. But it was interesting because you did get him to at least express his concern early on and through the last couple of months of getting this thing and then taking it home to his family, even if he's asymptomatic or has mild cases.
Right. And he's really been, I mean, on the front lines for 9 weeks. When it first started, he was the only doctor going in and setting up protocols. So he was one of the only ones for 9 weeks that went in to make sure that they had all their protocols for sanitization, PPE use, everything. So he really just said, hey, I'm going to do this. That way we're not exposing all the other doctors and staff. We'll get a protocol in place, standard operating procedure back in like March and April. And he was just the guy. And, you know, he's got kids and like all these doctors and nurses, you know, they got to make sure they're perfect with their PPE. And also I wanted to mention, you know, before we did the story, James, we didn't want to go in and use any of the PPE that would take away from the hospital staff. So like we had a large conversation with the CEO of Advent Health Tampa. We also had a conversation with our corporate risk to make sure that I didn't go in and then possibly take it out into the field, like putting myself in that situation. So we did risk management and assessment. And the reason we did the negative pressure floor is because I only had to wear that surgical mask across my face. I didn't have to have a fitted N95. Because initially I wanted to go into an ICU to see, the patients on ventilators, but it was too risky for me to go in and possibly contract it. We don't want to do that. And I think we were able to tell the story, seeing those patients in there without having to take that risk. But we definitely balanced all of those things before we went in.
Well, there was a great line. I don't want to take it away from you, but your writing in this piece also is just stellar, Mike. And I just have to say, you really got me with this one. It was something about it's a small window into what's a very large real world for the patients. I don't want to mess up the line, but it painted a very very grim picture for me of what these COVID patients are going through.
Yeah, the patients on the floor I was on, luckily some of them were on oxygen, none of them were on ventilators, which is great. And they looked just like I think I wrote, they looked like shells of themselves. It just was so sad to know that I could take my hand and put it on the nurse's station window, and just a few millimeters of glass right on the other side is the virus. And it started in January in China, and it was such a mysterious thing. And at first they said no human to human transmission, and then it all changed, and then boom, we're endemic, right. And then pandemic, So it was such a virus that started that was so unknown that no one knew where it was. And now it's here. It's just in every hospital everywhere across the state. It's in every, possibly grocery store. It's in every public place. You assume it's just everywhere, but to know it was in that room was freaky.
So anyone who's watched your reporting knows, I'm talking with Michael Paluska here, my colleague at ABC Action News, knows you're not afraid to put yourself in harm's way when it comes to hurricane coverage, any type of hard news type of coverage you've done. You stuck yourself right in the middle of it. You're not afraid. What were your feelings about going on to the COVID floor before you were setting up to do this?
I felt fine. Okay. Yeah, I didn't have any worries or any fear. Nothing at all. I think I've told you my wife's a nurse, and she kind of laughed because I went there for one day and shot for 20 minutes to limit my exposure, and she's on a COVID floor probably every day now for 12 hours a day. That does put in
perspective. Yes, yeah.
Maybe I cheated a little since my wife comes home every day from the hospital, but I couldn't also show fear either because she'd laugh at me because she's out there treating COVID patients every day. Let's
talk a little bit more about things you saw when you were in there. Now you wanted to talk a lot about treatments. That was the biggest thing. Yeah. Give me an idea of, we mentioned, the doctors always seeming to be clinical and not emotional. What's their attitudes like? Were you able to gauge that about how they feel about things and where we are? And especially in the state of Florida, as we've continue to have some very high numbers of cases every single day in comparison to other states.
Dr. Doug Ross said, we're not out of the woods yet. He's the chief medical officer at AdventHealth Tampa. And he is such a great resource to be able to talk to. And he really does give you the real deal about what they're dealing with. They're not at capacity. They're able to handle the surge, even in July when we had, 10,000 plus cases. And sadly, all the fatalities, were higher. But he said, if this had happened in March when we didn't have any treatments, he doesn't even want to think about what our fatality rate could be like today if we didn't do the lockdown orders, if we didn't slow the spread, if we didn't, get that curve back down. But the good thing about it is he said that the treatments that they are learning about are working. So remdesivir, number one, that's the antiviral drug that is made by Gilead. They are ramping up, trying to make as much of that as possible, but it was developed for Ebola as an antiviral, but it failed. And then they were like, all right, well, let's just try it experimentally. And so it got an emergency use through the FDA. It isn't cleared yet through the FDA to say, yes, this 100% works, but I think they're working on getting that. But it's an emergency use at this point for remdesivir, and the antiviral works great. If you start it early, it keeps their oxygen levels up. It stops the virus from multiplying in the cells. Mm-hmm. So the coronavirus, those little coronas on top will attach to the cells, and then they'll multiply. What the remdesivir does is it blocks that little crown on top, and it creates it, and it explodes it sometime, and it just defeats the cell. So it can't multiply. So remdesivir is huge. Convalescent plasma is another one that they've been using. People donating blood that
that's
have recovered.
That's those people who have had the virus and are able to donate blood, convalescent plasma.
If those people donate, they're saving lives left and right. And then, so they use both convalescent plasma, remdesivir. They're using a little mix of steroids, some anticoagulants, and they figured out the mix of oxygen so that people aren't getting on the vents because, you get on a vent and it's
well, I've got to bring it up because our president apparently is taking it. Any talk of hydroxychloroquine, where they stand on that? That's been a controversial drug from the beginning when it comes to treating this.
I've been reading so much on it, and I think it's been so saturated in the news, I didn't even mention it because I didn't even want the report to have any sort of political tint to it, and it's been tinged with politics. But I've talked to Dr. Ross about that before, and it's just not a viable treatment that they're using.
So we know what's viable for Advent Health Tampa, and that is remdesivir, convalescent plasma, and some steroids that they're using. And
anticoagulants and something else.
So they're seeing a lot of positive stuff. That's great. You mentioned you were so close to these patients separated by that window. Did anything you see in there change your perspective on the virus and the seriousness of it?
Yeah, I mean, when you see someone just laying in a hospital bed, unable to move, I think you can tell that they're sick with COVID. You know, I mean, you'd say yes, they're COVID positive, but I think the hard thing was seeing them so isolated. They only see the people that come in full like moon suits. I know a lot of hospitals have been doing the pictures on the outside so that patients can connect with a human being, but it really changed my perspective on how much we need to get a hold on it, because I may not get it, or I may get it and I may get sick, or I may not get sick at all. But when it impacts you and you end up all alone and isolated in that hospital, it hurts. You can just imagine someone that you care about in there. So that was really the hardest part. You just felt so sad for them, and you don't want anybody else to end up there.
Mike, there's more information from the doctors. They talked about how the virus doesn't, the word they used, it doesn't discriminate, right? So, at first we thought this was a concern just for the elderly, but, some doctors are refuting that right now.
Yeah, I mean, they said that they're seeing some older patients come in, walk right out, and they're seeing some younger patients get put on ventilators at Advent Health. So they're seeing a mix. And I also got an email after the story aired from just a viewer saying that his teenage daughters got it. And they did lockdown stuff and they got super sick, had to go to the ER. And so I was like, wow, so people have reached out to say, yeah, my kids got it. They're young. And that's the thing. It's just like the risk is too high.
Moving forward, though, they seemed very optimistic about just learning so much. Every single day is so important on that floor. That's the feeling I left with after watching your piece, is that, every day, every minute, every day, they learn more. They learn new things to do, new ways to, infuse those treatments or put them together, or try new things, whatever else. So certainly there's a positive message at the end of this piece.
Yeah, I think so. I took away a positive message, and I think the viewer emails that I got took away a positive message that, okay, we're trying to get a hold on it, but we still have a lot more work to be done. And I think it goes back to that whole you don't want to end up there sort of theme, that motif. I think there's probably a little bit, depending on how you look at it, a little more optimism in the treatments, but they can't cure everyone. And the death rate globally, I think it's like 170,000, 180,000 now with millions infected. So, one's too many. And how many more are we going to get to if we don't figure out a way to cure it or get a vaccine? That's the scary thing. And that's a long ways away. And we still have the crazy thing. Everybody mentions flu season. We still have flu season, and that kills a lot of people too.
Yeah, there's no question about it. And, I guess we can end with a little talk about the vaccine. Anything you want to pass along from talking to the chief medical officer or any other doctors you've spoken to? The one thing, I spoke with someone in the medical profession recently, and they kind of gave me a warning about the vaccine. And that is that, everyone's going to jump to take the first one that's approved. But really, oftentimes that can cause you a lot more pain than not taking it, because a lot of times these coronavirus vaccines can trigger certain symptoms that you wouldn't normally get. Now, this is just one person's opinion, okay? And they may have been a doctor, but I'd like to hear what information you've gathered about a vaccine and what we do, as a community, as a nation, when it is approved and it's out there and it's readily available.
Dr. Ross didn't go much into the vaccine stuff, to be honest, because it's so far out. And I think doctors are really hesitant. And I haven't done a rebound on some specific vaccines. So mine's just basic working knowledge of immunities and whether or not you'd have to take multiples. But I do know when it comes to the vaccine that they are looking forward to having something, but they are still worried about whether or not it'll work. And they're also worried about whether or not people will be too scared with sort of the anti-vax culture that we've seen with, the Hep A. People here, we had the local restaurant outbreak. So I think it's too soon for doctors to sort of get excited about until we actually see it.
And that makes sense. That's probably what I expected them to say at this point, because it's not viable. We don't have one yet. So they're not going to be reaching for that right now. They're going to be grabbing at what they have at their disposal. Just makes sense.
And the cool thing is, I think with the vaccine, building off of it, is that the CDC just released that you might have 3 months of immunity to coronavirus in their new
Right.
wording, which a lot of people have been trying to interpret and figure out. All right, well, is it, you have 3 months and then you can get it again. So I think they're getting better at figuring out what our actual immunity will be to get us to herd immunity. But then people talk about how herd immunity overseas didn't work. So I think we have to get the vaccine, figure out whether or not a lot of people are going to get it, and then figure out whether or not it works, and then how long it lasts.
I think that's really well put. I think
I'm just washing my hands, wearing a mask, carrying hand sanitizer in all my pockets.
Well, you're doing your part, and I'm doing my part too, because I'm one of the very few ABC Action News employees who's still going into the studio, and speak frankly about.
I'm going too. Yeah.
It is crazy. And to speak frankly to you about it, I mean, look, I talk to my floor. I see one person every day. I see a floor director / prompter operator. And I told them, I said, hey, look, we're going to stay 25 feet apart from each other, not because I don't want to be closer to you, but because if something were to happen where either of us were to get infected, I want to be able to have our bases covered out of respect for the company and everybody else who works here, and say, look, here's where I was, here's where I walked through, and I didn't come in contact with anybody within 25 feet. It's one of those, this is where we are in 2020, Mike. I mean, this is it. This is the best. I think it's the smartest way to go about it, is follow the guidelines and just do what's asked of you. I mean, look, I'm like everybody else. I didn't want something to come along and make all of us really scared of germs, okay? I didn't want to see that happen, but guess what? It did. So now you have to do your part, and now we don't want to wear masks, but you have to. You got to do what you need to do.
Look, I did the antibody test because I had like a cold, and at the end of February,
I remember you telling me about this. Yeah,
I got no antibodies. I got tested for coronavirus after all the riots and stuff, and getting in close contact with people that had been positive out on a story, and I've been negative so far, so I have a system. Everybody should get a good system in place. I literally wash my hands no matter where I come in from. I spray my hands every 10 seconds with this little alcohol spray. I don't touch my mask in the store. I just lock it down, and then when I got home, I take off all my clothes. I throw them in the washer. If I'm out on a story, I wash everything. I jump in the shower, dude. I'm just gonna ride this thing out. I'm just gonna ride it.
We gotta get you some good moisturizer for the hands. The stuff Shaquille O'Neal used to pump out there. Yeah, we got to get you some of that stuff, man. Mansturizer. That's what you need. Get the hands. Hey, he's Mike Paluska. Again, thank you so much for your time. The story will be linked up in the description of this podcast. I really encourage you to check it out. It's pretty eye-opening stuff, and it's scenes, it's pictures and images of something we haven't seen a lot of since the pandemic started, and that's right there on a COVID floor. So thank you, Mike, for doing that. Thank you for getting it out to everybody.
Thanks, brother. Talk to you soon, James.
New episodes of the Rebound Tampa Bay podcast drop every Wednesday morning. We have a video version of this for you on the ABC Action News streaming channel. Just download that to your favorite streaming device. This has been the Rebound Tampa Bay podcast. I'm James Tully.